Well, I've got a budding soccer player at home. We've also got a volleyball player. She's also in basketball. So it's good to get those kids part of a team.
They learn a lot, don't they? But when kids have asthma, playing any sport can be difficult. Some parents might wonder, is it even okay?
From OneWorld Community Health Centers, pediatrician Dr. Colleen Hannah Slagle. Thanks for stopping by, Doctor.
Thank you so much.
Yeah, looking forward to this conversation. Can you explain exactly what is asthma?
Sure. It is really a leading chronic medical condition in children that affects the small airways, and it's a hyperactive process basically that's happening in the airways with various triggers that causes inflammation and a secretion of mucus and tightening of the muscles surrounding the airway that makes it really hard to breathe.
And you hear kids sometimes say it feels like there's an elephant sitting on their chest. I mean, it's that crippling for them.
Right.
What are the triggers? Is it sports alone, or can it be other things?
There are definitely lots of triggers, and exercise is certainly one of the main ones, or one of the more common ones, but also viral respiratory infections and colds are a common trigger, as well as allergens in the air. Definitely
and right now we're seeing a ton of it.
Yeah, this time of year, definitely we're seeing that, as well as just the cold weather, climate changes, cigarette smoke, and other pollutants in the air can be triggers as well.
What should parents be on the lookout for? How can a parent tell if their child may be exhibiting some of these signs of asthma?
Right, and so asthma does look very different from one child to the next, but some common presentations might be the child that is very allergic and has a lot of either seasonal or year-long allergy symptoms, and maybe has eczema or a dry skin condition as a child.
I didn't know that was connected.
Right, they're all kind of this atopic triad of allergies, asthma, and eczema, and it's also usually a family history of those as well in the parents and the siblings.
Yeah, well, there's a study that just came out that tied like a peanut allergy to asthma. I said there was some sort of tie, and they thought maybe kids that had peanut allergies may have some connection to asthma.
Right, allergies definitely is one of those risk factors.
Of all kinds. And I'm thinking about my own story because I did have eczema as a child, but I wasn't diagnosed with asthma until I was around 15 years old.
Sure.
But it's so strange looking back at my own health history and starting to notice that there might have been a pattern developing there. So what can parents do to help their children manage asthma once they're diagnosed?
Right. Well, one thing is definitely following closely with your child's healthcare provider and coming up with a written down asthma action plan for your child to follow. Basically identify those triggers that is responsible for your child's symptoms and try to minimize exposure or treat those before symptoms actually happen.
I know some of the kids on my kids' sports teams have asthma. So I guess the question is, how does that affect sports if your child has asthma?
Well, if their symptoms aren't well controlled, it can definitely make it difficult to participate at the same level as your peers. However, we have wonderful treatment options now to help control and prevent asthma symptoms so that children should be completely able to participate in sports. And there's even Olympic athletes with gold medalists that have asthma. So it should not be a limiting factor, but it does need to be controlled.
So what do you recommend? Are there pills now that can address some things, or do you still mostly look at different types of inhalers once an attack comes on?
Right, inhalers are really kind of the mainstay for a rescue inhaler, as well as for chronic management and preventative management on a daily basis. There's other types of inhalers that can be used. And one important thing I think for parents to know is that you should always use your inhaler with a spacer or a chamber device to make sure the medicine's getting down into the lungs where it's actually working on that process.
And they're really easy to use, right? It's just one little pump and you breathe in. That way the medicine makes it where it needs to go. So kids of all ages can learn. There's no learning curve.
Well,
absolutely.
Yeah, those things have been around for decades. Have they changed at all? Or is it very similar to the inhalers?
It's very similar. I think some of the preventative medications, the inhaled steroids are a new preventative treatment for asthma. But the chambers, I think the spacer devices are something people are still kind of getting used to, but they're very easy to use and extremely effective.
You're talking about kids, as they get older, can they outgrow asthma?
It's a good question, and basically it is a chronic medical condition, so there is no cure for asthma. I think there is a group of young children, usually less than 4, that may have symptoms of wheezing with viral respiratory infections or colds, and those kids, many of those do not go on to develop asthma. So it is more those allergic type kiddos diagnosed later after the age of 5, or that sort of persist in their symptoms past that age. Really, even if their symptoms are well controlled over time, there's always that predisposition that they would have. And if they move to a new climate or with new triggers, their symptoms might reappear. So you should always have that on your past medical
Yeah, it's
history.
like you were diagnosed at the age of 15, and recently you had a little issue with asthma, right?
But you learn to control it, right? There are certain types of exercise. I know it's like hands off. I'd love to try it, but it's too rigorous. You know, my lungs just aren't down with it. So I'm curious, since you come to us from OneWorld, and for our viewers who are watching now, who can seek treatment for asthma at one of your clinics?
Absolutely. I mean, everyone is welcome at our clinics. We treat, you know, from newborns all the way to geriatric patients. And I'm a pediatrician, but we have family practice doctors that will be treating.
Well, and what I love about your mission is serving those who, you know, years and years ago might not have had access to care, but that's part of your mission, is to make sure that everyone does, and finding a way to get there. So we encourage you to look into that mission online. It's oneworldomaha.org. Of course, the main campus there on South 30th Street, but a few other clinics in the area. You can call 734-4110 if you'd like to learn more. The episode Mike's talking about is I almost missed my flight to get back to Omaha, and I was running so fast, and by the time I got to my gate, I was out of breath and wished I had my inhaler. It would have been a smart move on my part. But thank you, Doctor, for coming in today. It's nice to meet you.
Nice to meet you.
All right, in the world of racing, the Ray Halls, they've been around for decades.
Right now, Graham Rahal is gearing up for the Indianapolis 500. He'll explain how on the other side of the break.